Yeah, so Varithena is actually a brand name. So it's the procedure itself is ultrasound guided sclerotherapy. And the Varithena is the actual product or the foam that is used in that sclerotherapy procedure. It's relatively new. It's about, I would say, it's about coming up on around 3 years of being on the market. It had been studied for many years. Procedures like this, when there's a new product being introduced, just has to go through extensive research and studies before Medicare and the private insurers, all of the payers will approve of the product and the procedure being done with the product. So we've been it's relatively new to us. It's probably been around for quite some time, but it just has not been available to the medical community and, for procedures on a, kind of an open scale. It was more, I'm sure it was experimental for some time. Sure. And just to, expound a little bit and clarify what sclerotherapy is, that's injecting a chemical or a medicine into veins or a vein in the attempts of closing that vein or getting that vein to eventually scar. And that's where the term sclero comes from, sclerotherapy, getting the veins to scar and eventually go away. So that scar tissue under the skin, which was at one point a vein with blood flowing through it, your body will eventually break that down and make it go away. And with these particular veins that we're treating, that's what we want. Those veins are diseased, they're no longer functioning properly, and they're causing the person more problems than they're worth, if you will. They're not helping in many respects, causing pain, being the source of swelling, because the blood in the vein starts to create pressure and make its way. Some of the fluid actually makes its way out of the veins into the tissues and causes swelling. And then a lot of other symptoms, such as itching, burning, cramping of muscles, restless leg type syndrome, which affects people at night. A lot of times makes it very difficult to sleep. Things like affecting the skin, from the mildest thing, like a little flaking and dryness of the skin, to the more severe problems where the skin starts to get darkened, gets thickened, and creates little wounds in the skin that become very difficult to heal. So to get back to your original question, which patient is ideal for that? Most people will qualify or be appropriate for that type of treatment if they have varicose veins that are, have been identified by ultrasound to be abnormal from the standpoint of backwards flow or reflux within the veins. So the ultrasound has a way of measuring that with certain maneuvers during the test.